Our project was on MRSA, which also stands for methicillin-resistant Staphylococcus aureus. The Staphylococcus aureus was discovered in the 1880s. In the 1940s, medical treatment became successful with the discovery of penicillin. In the late 1940s to the 1950s, Staphylococcus aureus developed a resistance to penicillin. Methicillin was then created to help with the resistance, and the first strains of the Staphylococcus aureus that resisted methicillin was MRSA in 1961. The first reported case of MRSA was in 1968.
MRSA looks like small reddish bumps that appear to be infected pimples filled with pus, spider bites, small infected boils, or open festering sores.
The symptoms of MRSA include joint pain, fever, chill, shortness of breath, and headaches.
MRSA is transmitted when infected areas of the skin are touched. MRSA is also transmitted through personal items such as razors, clothing, towels, and bed sheets. MRSA can also be transmitted through public items such as doorknobs, gym equipment, and tattooing.
MRSA secretes a kind of peptide created by amino acids that causes the immune cells to burst. The compound creates inflammation, which causes the immune cells to be drawn towards the infected site, where the compound then kills off all of the cells in that area.
MRSA has a high rate of infection in places like East Asia, Japan, Korea, and Taiwan because of their antibiotic usage.
It doesn't really make a difference if you're healthy or not because of how easily MRSA is transmitted from one person to another. Basically, everyone has a risk of getting MRSA, so everyone needs to stay as healthy as possible. The treatments include incisions and drainage, special antibiotics, and amputations. In order to prevent MRSA, you shouldn't make direct contact with infected areas on skin. You should cover up any open wounds with Band-Aids and stay clean.
About 90,000 people in the U.S. are infected with MRSA each year. MRSA was first discovered in hospitals. MRSA resists antibiotics, which makes it hard to treat. In order to stop MRSA from spreading throughout your body, limbs may have to be amputated.